Our bodies often send subtle signals when something's wrong. If you see a black line on your nail, swollen neck veins, uneven pupils, small dents on your back, a buffalo hump, club fingers, red palms, a swollen belly, or sudden hair loss, your body's screaming for help. These aren't just normal changes, they're danger signs that something is seriously wrong inside you. Some mean cancer, heart failure, or even organ damage. And this new video of Forever Green will show you 35 alarming body symptoms that may indicate serious health risk. If you notice any of these, don't wait. Call a doctor now. Your life could depend on it. Here's what each sign could mean and why you should act fast. 35. Black line on a nail. A black line on your nail could be subungual melanoma, a serious type of skin cancer. This happens when the cells that give color to your nail grow too much and form a dark streak. It might look like a simple bruise at first, but if the line gets wider, darker, or doesn't fade, it's a big warning sign. This cause could be too much sun or just bad luck with genes. If you notice a black line on your nail, especially if it changes, hurts, or bleeds, go to the doctor right away. Don't wait. This isn't a normal bruise or stain. Waiting could be dangerous because catching it early makes treatment easier. 34. Visible neck vein dissension. If you notice thick, bulging veins in your neck when you're trying to sit or lie down, it might be a sign of heart failure or fluid overload. This is called jugular vein distension. When your heart can't pump blood properly, blood backs up in your veins, making them swell. Fluid overload happens when your body holds too much water, often from kidney problems or eating too much salt. If your neck veins stay swollen even when you're relaxed, or if you also feel short of breath or tired, see a doctor right away. This isn't normal. Your heart or kidneys might need help fast. 33. Spider veins. If you see tiny red or purple lines on your skin that look like spider veins, these are spider veins or telangiectasia. They often appear on the face, chest, legs, or hands. While they can be harmless, sometimes they signal liver disease or hormonal problems. Liver disease often happens from too much alcohol, viruses, or fat buildup which damages the liver and affects blood flow. Hormonal imbalance caused by pregnancy, birth control pills, or thyroid issues can also cause them. If you notice many spider veins suddenly, especially with yellow skin, tiredness, or belly swelling, see a doctor immediately. Your liver might need help. 32. Pupils of unequal size. If one pupil is bigger than the other, called anisocoria, it could mean a brain aneurysm or stroke. An aneurysm is a weak, bulging blood vessel in the brain that could burst. A stroke happens when blood flow to part of the brain stops. Both are very serious. Sometimes people are born with slightly different sized pupils. But if this appears suddenly with headaches, blurred vision, or dizziness, call emergency services now. The pressure in your brain might be too high. Fast treatment can prevent permanent damage or save your life. Check your pupils in a mirror if you feel strange. 31. Blue lips. If your lips turn blue, called cyanosis, it means your body isn't getting enough oxygen. This could be from hypoxia, low oxygen in the blood, or your heart isn't pumping blood properly. Cold weather might make lips bluish temporarily, but if they stay blue when you're warm, it's serious. You might also feel short of breath, tired, or dizzy. This happens because oxygen-rich blood isn't reaching your skin. If your lips, fingers, or skin suddenly turn blue, especially with chest pain or trouble breathing, go to the emergency room immediately. If you like this video so far, leave a like, and you can also check out people with the longest body parts in the world on our channel Forever Green. 30. Buffalo hump. If you notice a thick, fatty lump growing between your shoulders, known as buffalo hump, it could mean Cushing's syndrome. This happens when your body makes too much cortisol, a stress hormone. The extra fat gathers on your upper back, face, and belly, while your arms and legs stay thin. Causes include taking too many steroid medicines or tumors that make hormones. You might also get stretch marks, feel weak, or bruise easily. If you see this unusual fat growth, especially with other changes, see a doctor right away. Without treatment, Cushing's can weaken bones and cause diabetes. 29. Small dents on your lower back. If you notice small dimples or dents on your lower back or hips, called skin dimpling, it could signal serious health problems. These dimples often appear when fat tissue pushes through weak spots in your skin's connective tissue. While some dimples, known as dimples of Venus, are normal, sudden dimpling with redness or pain might indicate an infection, deep vein thrombosis, or autoimmune diseases. If the dimpled skin feels warm, looks red, or appears suddenly with swelling, see a doctor immediately. It could mean trapped fluid, blood clots, or inflammation needing urgent treatment. 28. Bulging eyes. If your eyes look like they're popping out, it might be hyperthyroidism, an overactive thyroid caused by Graves' disease. This happens when your thyroid gland makes too many hormones, causing swelling behind your eyes that push them outward. You might also notice rapid heartbeat, weight loss, and shaky hands. Graves' disease is when your immune system accidentally attacks your thyroid and eye tissue. If your eyes look more open than usual, feel dry, or you see double, see a doctor immediately. Without treatment, this can cause damage to your vision. 27. Clubbed fingers. If your fingertips become thick and rounded like drumsticks, it's called clubbed fingers. This can signal lung cancer or heart disease. This happens when your blood doesn't carry enough oxygen, making the soft tissue under your nails grow wider. Your nails may curve downward and feel spongy when pressed. Lung problems like cancer or infections often cause this, but heart defects can too. If your fingers slowly change shape over months, especially with coughing or shortness of breath, see a doctor immediately. Don't ignore this unusual change. 26. Red palms. If your palms turn unusually red, a condition known as palmar erythema, it might mean you have liver cirrhosis, scarring of the liver. This happens when the liver gets damaged over time, often from too much alcohol, viruses like hepatitis, or fat buildup. A damaged liver can't clean toxins from your blood properly, causing extra blood flow to your hands, making them red. Other signs include tiredness, yellow skin, or a swollen belly. While red palms can sometimes run in families, if they appear suddenly along with other symptoms, don't ignore it. See a doctor right away. 25. Purple skin patches. Purple spots or patches on your skin that don't hurt when touched, known as purpura, might mean you have blood clotting problems or vasculitis. Clotting disorders happen when your blood can't thicken properly. Vasculitis means your blood vessels are swollen and may leak blood under your skin. These patches often appear on legs first. Causes include infections, some medicines, or immune system errors. If purple spots appear suddenly without injury, especially with fever or weakness, it could mean your blood isn't working right and you might bleed dangerously inside your body. 24. Cherry angiomas. Small bright red bumps on your skin called cherry angiomas are usually harmless but can sometimes mean liver toxicity. This happens when your liver struggles to remove toxins from your body, often due to too much alcohol, certain medicines, or chemical exposure. These bumps are clusters of blood vessels and may multiply if your liver isn't working well. If you notice many new red bumps suddenly, especially with tiredness, yellow skin, or belly pain, see a doctor fast. 23. Red butterfly-shaped rash across cheeks. If you get a red rash shaped like a butterfly across your nose and cheeks, called a malar rash, it might mean a sign of lupus. Lupus happens when your immune system attacks your own body by mistake. The rash often gets worse in sunlight and might feel warm or scaly. You might also feel very tired, have joint pain, or get fevers often. Lupus can damage your kidneys, hearts, or lungs if untreated. If you see this butterfly rash, especially with other symptoms, see a doctor immediately. Blood tests can check for lupus. 22. Swollen, tender belly. A swollen, tight belly that feels tender could be ascites. Fluid buildup caused by liver cirrhosis or liver cancer. Cirrhosis often happens from long-term alcohol abuse, hepatitis, or fatty liver disease. Cancer can start in the liver or spread there from other organs. A damaged liver can't make enough protein to hold fluid and blood, so it leaks into the belly. If your belly swells quickly, feels hard, or you also have yellow skin, weight loss, or vomiting, go to the ER immediately. This fluid can infect or press on organs, leading to life-threatening emergencies. 21. White patches in the mouth. Thick white patches inside your mouth or on your tongue, called leukoplakia, can be a warning sign of precancer. These patches often appear on the tongue, gums, or inside cheeks, usually from smoking, chewing tobacco, or rough teeth irritating the skin. While not always dangerous, some patches can turn into mouth cancer if left untreated. If the white spots feel rough, change shape, or last more than 2 weeks, see a doctor immediately. They might need to test a small piece to check for cancer cells. Quitting tobacco and fixing dental problems can often make these patches go away before they become serious. Before proceeding to our next selection, we invite you to explore our video on rare and unique people that are 1 in a million. Now, let's back to our list. 20. Jaundice. Yellow skin or eyes, called jaundice, means your body has too much bilirubin, a yellow waste substance. This usually happens with liver disease or a bile duct blockage. Your liver normally filters out old blood cells, but when it's damaged from viruses, alcohol, or other causes, yellow pigment builds up. A blocked bile duct, which carries waste to your gut, can also cause this. If you notice yellow skin with dark urine, itchy skin, or belly pain, see a doctor immediately. 19th. Sudden rash with swelling. If you suddenly get a rash with swelling, especially on the face, lips, or throat, could be anaphylaxis, a life-threatening allergic reaction. This happens when your body overreacts to things like foods, medicines, or insect stings. Your skin may break out in itchy red welts. Your face or throat might swell, and you could have trouble breathing. If you develop a rash with swelling of the lips, tongue, dizziness, or breathing problems, call emergency services immediately. Don't wait. Anaphylaxis can block your airways completely. Always carry an epinephrine pen if you know you have severe allergies. 18. Spoon-shaped nails. If your nails curve upward like a spoon, it's called koilonychia and could mean severe iron deficiency anemia. This happens when your body doesn't have enough iron to make healthy red blood cells. Your nails become thin, soft, and dip in the middle while the edges rise up. Causes include not eating enough iron-rich foods, blood loss, like heavy periods, or stomach problems that prevent iron absorption. If you notice spoon-shaped nails with pale skin, extreme tiredness, or shortness of breath, see a doctor immediately. Severe anemia strains your heart and can cause permanent damage if untreated. 17th. Scalp tenderness. If your scalp hurts when you touch or brush your hair, called scalp tenderness, it could be temporal arteritis, a dangerous inflammation of blood vessels in your head. This condition mostly affects people over 50. The arteries near your temples swell up, causing pain when you chew, headaches near your forehead, and sometimes fever. Without treatment, it can suddenly make you go blind or cause a stroke because inflamed vessels can't carry enough blood. Blood tests and treatment with strong medicine can prevent permanent damage if started quickly. 16. Darkened skin creases. If you notice dark, velvety patches in skin folds like your neck or armpits, called acanthosis nigricans, it often means insulin resistance, when your body stops responding properly to blood sugar. This usually happens before diabetes develops. In rare cases, these dark patches can signal cancer, especially if they appear suddenly in adulthood.
The skin thickens and darkens because too much insulin or cancer chemicals make skin cells grow abnormally fast. If you see these dark patches, especially with weight gain or excessive thirst, see a doctor immediately. 15. Painful red joints. If your joint suddenly becomes hot, red, and so painful you can't touch it, it could be gout or septic arthritis. Gout happens when uric acid crystals build up in the joint, often in the big toe, making it swell and hurt terribly. Eating too much meat or drinking alcohol can trigger it. Septic arthritis is more dangerous. It's an infection inside the joint that can destroy it fast. You might have fever with this one. Both conditions need prompt treatment. Gout with special medicine, and infection with antibiotics to save your joint. 14. Facial drooping on one side. If one side of your face suddenly droops or feels weak, it could be Bell's palsy or a stroke. Bell's palsy happens when a facial nerve gets swollen, usually from a virus, making half your face temporarily paralyzed. A stroke is more serious. It means blood flow to part of your brain stopped, often from a clot. With Bell's palsy, you might just have trouble closing one eye or smiling. With stroke, you'll likely also have arm weakness or slurred speech. If your face droops suddenly, even if it's painless, call emergency services immediately. 13. Scaly, crusted patches on elbows or knees. Thick, scaly patches on elbows or knees, like dry, cracked skin, could mean psoriatic arthritis, when joint pain and swelling develop alongside skin problems. This happens because your immune system attacks healthy skin and joints by mistake. The patches look red with white scales and may crack or bleed. Without treatment, the inflammation can damage joints permanently. Special medicines can control both skin and joint problems if started early. Ignoring it may lead to deformed joints that can't be fixed. 12th. Lumps in the neck. If you find hard lumps in your neck that don't go away after a few weeks, it could be lymphoma, cancer of the lymph system, or metastatic cancer that spread from elsewhere. These lumps are usually painless and keep growing. Lymphoma happens when white blood cells grow out of control. Metastatic cancer means cancer from another body part, like lungs or thyroid, reached your lymph nodes. If you notice neck lumps with weight loss, night sweats, or constant tiredness, see a doctor immediately. A simple biopsy can check for cancer. Catching it early makes treatment work better. 11th. Swelling in legs. If your legs or ankles swell and leave a dent when pressed, it's called pitting edema. It often means heart failure or kidney failure. When your heart can't pump well, fluid backs up in your legs. When kidneys don't work right, they can't remove extra water from your body. The swelling usually starts in feet and moves up, getting worse as the day goes on. If your shoes feel tight suddenly or socks leave deep marks, check for pitting by pressing a finger into the swollen area for 5 seconds. If the dent stays, it's serious. See a doctor immediately if this happens with shortness of breath or needing to pee less. 10th. Sudden hair loss. Losing hair in clumps or patches suddenly could mean alopecia areata, an autoimmune disorder. This happens when your body's defense system attacks your hair roots by mistake, often due to stress, genes, or other immune issues. Hair falls out in round patches, sometimes on the scalp, eyebrows, or beard. While not deadly, it can signal other autoimmune problems like thyroid disease or lupus. If your hair drops out fast, especially with nails pitting or rashes, see a doctor immediately. 9. Red eyes with light sensitivity. If your eyes turn red and hurt when you look at light, called uveitis or acute glaucoma, it's an emergency. Uveitis means the middle eye layer is inflamed, often from infections or immune problems. Acute glaucoma happens when eye pressure builds up dangerously fast, usually in people over 60. Both make light seem too bright, cause throbbing pain, and can blur vision within hours. With glaucoma, you might see rainbow halos around lights and feel sick to your stomach. If your eye stays red and light hurts more than usual, see an eye doctor immediately. Waiting could make you go blind. 8. Curved spine in adults. If your upper back starts curving forward like a hunchback, called kyphosis, it could mean osteoporosis or a spinal infection. Osteoporosis makes bones weak and crumbly, so vertebrae can collapse and bend your spine. This often happens in older adults, especially women after menopause. A spinal infection is more serious. Bacteria or fungi eat away at bones, making them collapse. If you notice new rounding of your back with height loss, back pain, or fever, see a doctor immediately. Waiting makes the curve worse and harder to fix. 7. Toes turning blue or purple in cold. If your toes or fingers turn white, blue, or purple in cold or stress, it's called Raynaud's phenomenon. This happens when tiny blood vessels in your hands or feet squeeze shut too hard, blocking blood flow. Sometimes it's a sign of autoimmune diseases like scleroderma, where the body attacks its own skin and blood vessels, making them thick and stiff. Scleroderma can trap blood in your toes, causing lasting damage. If your toes stay blue, even when warm, develop sores, or your skin feels tight, see a doctor immediately. Ignoring this could lead to ulcers or organ damage. 6. Sudden hair whitening. If your hair turns white suddenly, called candidase, it might mean autoimmune problems or extreme stress. Normally, hair whitens slowly with age, but rapid whitening can happen when your immune system attacks hair pigment cells by mistake. Severe stress may also drain color from hair follicles. While rare, this sudden change sometimes links to thyroid disease or vitamin deficiencies. If sections of hair whiten within weeks, especially with other symptoms like tiredness or weight changes, see a doctor immediately. 5th, finger joints enlarging symmetrically. If your finger joints on both hands swell, feel stiff, or look bigger than normal, it might be rheumatoid arthritis. This happens when your immune system attacks your own joints by mistake, making them stiff, warm, and painful, especially in the morning. Unlike regular arthritis from aging, rheumatoid arthritis affects matching joints on both sides. Over time, it can bend fingers sideways and damage bones permanently. If your fingers look swollen symmetrically for more than a few weeks, see a doctor immediately. 4. Abnormal hair growth in women. Thick, dark hair growing on a woman's face, chest, or back, called hirsutism, can signal polycystic ovary syndrome, PCOS, or an adrenal tumor. PCOS happens when ovaries make too many male hormones androgens, often due to insulin resistance or genetics. Adrenal tumors are rare growths on adrenal glands that pump out excess hormones. Both conditions disrupt normal hair patterns and may cause acne, weight gain, or irregular periods. Untreated PCOS raises diabetes risk, and adrenal tumors can be cancerous. Don't just shave it off, get checked. 3. Thickened, enlarged hands or feet. If your hands, feet, or face slowly grow larger and thicker, it could be acromegaly, caused by a pituitary tumor, a non-cancerous growth in the brain. This tumor makes too much growth hormone, causing bones to thicken over years. You might notice rings no longer fit, shoes feel tight, or your jaw sticks out more. The tumor isn't cancerous but can press on brain parts and damage organs. If your features seem coarser or you need bigger hats, gloves. See a doctor immediately. Removing the tumor stops further changes, but existing bone growth can't reverse. 2. Changing moles. If a mole changes shape, color, or size, called melanoma, it could be skin cancer. Look for moles that aren't round anymore, have blurry or jagged edges, turn darker, lighter, or patchy, and grow bigger than a pencil eraser. Melanoma happens when sun damage or genes make skin cells grow wildly. If a mole itches, bleeds, or looks different from others, see a doctor immediately. 1. Hutchinson's sign. If you see a dark streak on your nail that spreads to the skin around it, called Hutchinson's sign, it likely means advanced melanoma, the most dangerous skin cancer. This happens when cancer cells grow under your nail and into nearby skin. The streak may look brown or black and keep getting wider. Unlike nail injuries, it won't grow out or heal. Melanoma here spreads quickly to other body parts. If your nail has a dark line that reaches the cuticle or skin, see a doctor immediately. Don't wait. This type of cancer needs fast treatment to survive. These symptoms may not always mean a severe condition, but they require immediate medical attention. Early detection saves lives. Don't ignore changes in your body. Thanks for watching. See you next time on Forever Green.